What is a panic attack and what is panic disorder? Let us talk about this topic in this video. I'm Dr. Praveen Tripathi. I'm a consultant psychiatrist and sexual disorder specialist. So I'll tell you about a patient of mine. I saw him a couple of days back. So this patient, a couple of weeks back, started having symptoms. One fine day, he was just lying down on the bed, relaxing, and suddenly he felt that there was some feeling of tightness in the chest. And he also felt that there was difficulty in breathing, slight difficulty in breathing and sweating. So this guy is around 35 years old. He's otherwise healthy, non-smoker, does not use alcohol that frequently. He felt that something is happening, some kind of reflux or acidity, and he was told by his family members to just drink water and relax. But that did not help. There was definite heaviness in the chest, and he rushed to the emergency department of the nearby hospital. When he reached over there, blood pressure was taken, sugar levels were taken, BP came out to be slightly on the higher side. ECG was done and ECG came out to be normal. The doctor told him that everything looks fine with your heart, although BP is slightly elevated, but it is nothing to worry about. And the doctor told him that it looks like anxiety, and gave him some pills, gave him an anti-anxiety pill, and told him to go back to home. The patient was slightly surprised to hear that he had anxiety symptoms, because he was otherwise a physically fit person, and he also felt that there's nothing going on in his life which is stressful, neither at the personal front nor at the professional front, and there was no reason for him to feel anxious. He was prescribed some tests also. He got those done, and there was nothing alarming in those tests. The lipid profile was slightly deranged, but nothing serious. Everything was fine for a couple of days, and then again there was another attack. Same thing happened. Night time, he felt that there was congestion in the chest, heaviness in the chest. He also felt that this feeling of discomfort in the chest, and there was this pain which was radiating towards the left arm. And he had heard multiple times that when the pain radiates towards the left arm, probably it is something to do with your heart. So again he rushed to the same hospital emergency department. Again all the tests were done. Again the ECG was done, and it again came out to be normal. Now the patient started getting slightly alarmed, because it happened on 2 occasions. So he decided that he would go and meet some senior physician. So he went to a physician, MD medicine doctor, who heard about the symptoms, wrote a couple of more tests. He also advised that get your echo done, echocardiography done. And the echo was done, it also came out to be normal. The ECG was repeated, it also came out to be normal. More tests were done, everything was fine. The doctor told him that everything looks good, just exercise more, relax more, do not take too much of stress, sleep better, and all these things were told to him. Patient came back home. He was still not convinced. The thought that what if the doctors are missing something, that was playing in his mind. And a couple of days later, again he had similar symptoms. So this time he was determined that he would get into the root cause of it. He went to a cardiologist, and the cardiologist again repeated the test. He also got some other tests done, like Holter monitoring, which is basically ECG for 24 hours. And that was done. Even that came out to be normal. The cardiologist told him that it appears to be anxiety. The cardiologist told him for the first time the term panic attack, that it appears that you have been having panic attacks. And the cardiologist actually asked him to go and meet a psychiatrist, but the patient was a bit reluctant. The patient told me that in our country, in fact in every country, it is not so easy to meet a psychiatrist. People have their own stigmas, and they are at times afraid also of psychiatric medication. So he avoided coming to a psychiatrist. Instead, he asked the cardiologist to prescribe some medicines to him, which cardiologist did. He gave some anti-anxiety pills. That helped him partially, but the symptoms did not go away completely. Every now and then the patient would feel something happening in the chest, and every time all the investigations would come out to be normal. After a few days, the symptoms started increasing. The patient would have this fear that what if the next panic attack is there and there's nobody to help him out. So he stopped driving. He said that this thought came into his mind that if he is driving and suddenly he had that attack, and nobody is with him, he drives alone, and if he gets into an accident, or if something serious happens, nobody would be there to help him out. So he thought that it would be better to stop driving. So he stopped driving. He started using the metro, And in the metro also, he realized that when he went into the station, which is of course crowded, he would feel that little bit of discomfort. Again, the thought that everybody is around, what if something happens to me? How would I get out of this metro station? All those things would trouble him. Even traveling by metro was not so easy. Whenever the metro would go into the tunnel, he would have this thought that what if the metro stops? What if there's some problem, some technical snag in the metro stops, and how would he get out of it? And he would have that feeling of suffocation. So after some time, he stopped traveling by metro also, and he started taking cabs. That was a financial drain for him, but nonetheless he decided that it's better to take cabs. But the symptoms became even worse. He was not comfortable even taking cabs, and then he started insisting that he would work from home only, because he cannot go out of the house without somebody accompanying him, because again the same thought that if something were to go wrong, who would help me? So these things continued, and finally on the advice of the cardiologist, finally he decided to meet a psychiatrist. He came to our center, and we took the history, we made the diagnosis, and we told him that this is panic attack, and when you have panic attacks multiple times, you call it panic disorder, and we prescribed him certain medications and treatment. So coming back to the term panic attack, when do we call it a panic attack? If you go by the definition of panic attack, it says that panic attack is an acute attack of intense anxiety. So basically it happens suddenly, and there is very severe anxiety. The anxiety is really intense, and when the person is having that attack, he feels that he is about to die, or something sinister is about to happen. There might be a heart attack, or there might be a seizure, or the person would just collapse. So the anxiety is so much that the person feels that something really bad is about to happen. And when somebody starts having these panic attacks repeatedly and unexpectedly, we call it a panic disorder. Now the second part of his problem, where he started avoiding going to the crowded places, he started becoming afraid of crowded places, he started becoming anxious of traveling alone, he started becoming anxious of closed places. All of that is called as agoraphobia. So often it happens that it starts with panic attack, and then there are these symptoms which are called as agoraphobia. So panic disorder with agoraphobia is the final diagnosis. Now, why does one has panic attacks? Now, before I talk about that, what we see is that in certain individuals, these panic attacks are preceded by something. Many patients, tell us that they heard that somebody in their family had a heart attack, or somebody in their family was diagnosed suddenly with cancer, or somebody suddenly collapsed, and after hearing that news, they started feeling uncomfortable, and from there all these things started. Some other patients tell us that they heard some celebrity death. For example, in India, a couple of months back, a celebrity, Mr. Siddharth Shukla, unfortunately he died suddenly, and that led to increased anxiety in many patients. And in some cases, there is no clear-cut reason, there is no clear-cut trigger. They just start having these symptoms out of blue. So if we talk about the reason behind panic attacks and panic disorder, there are multiple factors involved. We can talk about the brain chemistry, the neurotransmitters in our brain, which determine almost everything. So it has been found that serotonin as well as norepinephrine, these are the two neurotransmitters which are involved in the development of panic attack, their abnormalities, and that is why the medications work. They primarily work on these chemicals. But it's not only about the chemicals. What we also observe is that in patients with panic disorder, there is a cycle. So what happens is, if you have a panic attack, if you had an anxiety attack, and if you are afraid that it might happen again, at some level you start scanning your body. You are more observant of what is happening in your body. So even if there is something innocuous, just you feel that the heartbeat has increased, which may happen with anybody, you are more likely to give importance to that, or you are more likely to give attention to that. So say your heartbeat increases, there is some palpitation, and you start focusing on that. You become anxious that something is going on, and because of that anxiety, that palpitation further increases. When the palpitation further increases, you feel even more anxious. When you feel even more anxious, then there are other symptoms like heaviness in the chest, difficulty breathing. When that happens, you become even more anxious. So it's a cycle. Symptom, anxiety, more symptom, more anxiety, and finally that cycle ends up in a panic attack. And once that panic attack happens, the person becomes very scared. They start scanning their body even more. They start looking for any signs of something wrong with them, and that ensures that the cycle continues. So not only the neurotransmitters, these things that happen, they also play a major role in the development of panic disorder. When we talk about the treatment of panic disorder or panic attacks, we say that we should not, or we cannot simply assume that it's a panic attack. We talked about the investigations that the patient got done. What we usually see is that patient gets investigations repeatedly. They by the time they reach a psychiatrist, they have gotten the ECG done 10 times, echocardiography has been done maybe 3 times, Holter monitoring has been done 2-3 times, and they have also gone from doctor to doctor. They meet multiple doctors. This thought that what if the doctor is missing something? What if there's something that is there in the investigations, but nobody is picking it up? Those thoughts ensure that the patient goes from doctor to doctor. So we should remember that although excessive investigation is not necessary, but a person should be thoroughly investigated to rule out any physical cause before we can go ahead with the diagnosis of panic attack or panic disorder. So in this case, like in other cases, the investigations were done, so we were pretty sure that there's something wrong physically with the guy. When we start the treatment, if you go to a psychiatrist, the treatment is quite standard. A combination is used of SSRIs, selective serotonin reuptake inhibitors, and the benzodiazepines. So benzodiazepines are the pills that immediately help with the reduction of symptoms. But the problem with them is that they are not given for a longer period of time. Why? They may be habit forming. So what most of the psychiatrists would do is they would start the SSRIs and the benzodiazepines together. In few days or weeks, they would taper down the benzodiazepines and stop them, and the SSRIs would continue for a couple of months. Now, what happens is many of these patients are not so willing to go to a psychiatrist. They are already anxious, and then they have again anxiety, anxious thoughts that what if I become addicted to the medicine? What if I have a severe side effect of the medicine? And when these patients come to us, they always ask these questions. So we have to remember that of course any medication can cause side effect. For that matter, even medications that people take on their own like paracetamol and all, even they can cause side effects. But when we talk about the side effects of anxiety medicines or the depression medicines, they are usually very mild side effects, something like acidity, or some people may have loose stools in the first week. Most of these side effects can be taken care of by taking medicines after meals, and even then if somebody is having some trouble, you can always take an antacid or something to ensure that in the initial week the side effects are taken care of. Usually side effects are seen in the first week only, first week or two. So the treatment was started, SSRIs were started, benzodiazepines were started, benzodiazepines were tapered down and then stopped, SSRIs were continued. And not only the medical treatment, it is equally important to start with the psychotherapy sessions in such cases. So in psychotherapy, primarily CBT is done. Basically, patient is told to identify that he is giving too much importance to the normal physiological symptom. He is told to talk to himself that these are the anxiety symptom. It is not something related with my heart. Patients are told to stop from getting into that cycle. And the therapy is usually done by a clinical psychologist. Many times what we see is when we tell the patient to go and see a clinical psychologist or a counseling psychologist, the patients say that they don't need counseling, they themselves understand everything. Or sometimes patients say that their parents do very good counseling or their siblings do very good counseling. Now we must remember that when you go to a psychologist is not just indulging into a chit chat with you. It's not a normal conversation. A psychologist would understand your symptom and would give you therapy according to some kind of model. Usually CBT is given, and chit chat with your siblings or friends or parents is not bad, of course, but it's not a substitute for therapy from a professional. So this thing must be remembered that therapy is not something that anybody can give. So in these patients with panic attack or panic disorder, like it happened with this particular gentleman, a combination of medical treatment and therapy is what works the best. In individual cases, only therapy may be offered or only medications may be offered, but usually a combination is what works the best. And the problem is that because of lack of knowledge, lack of understanding about the anxiety symptoms or symptoms of other psychiatric disorders, and add to that the stigma, the fear that if I go to a psychiatrist, what will people say? All these things combine and stop the patients from seeking treatment at the right time. Many times patient insists their cardiologist or physician to write medications for them. Now the problem with that is, even if your cardiologist or medicine guy is writing you medications for psychiatric problems, even if he is doing with all good intentions, it is unlikely that he would be do it properly. And that's not surprising. For example, I'm a psychiatrist. If you ask me to treat hypertension, high blood pressure, or sugar, I can do that. But I would not be able to do it as well as a physician, because I'm not trained in that. A physician is better trained in that than somebody like me. Similarly, when it comes to psychiatric issues, a psychiatrist is trained better in ensuring that you are getting the right dosage for the right period of time, and ensuring that you are getting the therapy sessions. So it's very important that you go to the right doctor, you meet a psychiatrist or clinical psychologist at the right time, and the treatment is started. Many times we see that patients end up wasting months or years of their life. Their work gets impacted, their personal life gets impacted, and by the time they reach the doctor, they have lost a lot. So we keep on telling people that please don't waste time. If you're having issues, once it's diagnosed, go and meet a doctor.
अगर आपको डिप्रेशन की समस्या है तो आप डॉक्टर प्रवीण त्रिपाठी से सीख सकते हैं कि डिप्रेशन के पेशेंट्स में काउंसलिंग कैसे की जाती है और उन टेक्निक्स को यूज करके डिप्रेशन से बाहर निकलने की जर्नी को शुरू कर सकते हैं। स्क्रीन पर दिए कार्ड को क्लिक करें या फिर डिस्क्रिप्शन में दिए लिंक को क्लिक कर डॉक्टर प्रवीण त्रिपाठी के कोर्स में एनरोल करें।
Our aim is to fight the misinformation that is prevalent about the sexual disorders and the psychiatric disorders, fight the stigma, and the only way of doing it is to give the right information. And these videos are a part of the same. So I hope I was able to tell you something about panic attacks and panic disorders. And if you like such kind of content, you can definitely join us. Thank you.